everyone. Thank you so much for joining us on a really incredible topic. We're going to be talking today about the Climate Health and Energy Equity Lab, the CHILL Lab. It combines research, practice, and teaching to advance just approaches to climate mitigation and renewable transitions. Joining us on the call today was co-founded by Dr. Carol Ziegler, the Vanderbilt School of Nursing, Dr. Badraba, Tim Kovai, I apologize. We're going to, Dr. Z, we'll say that. How about that? Program in Climate and Environmental Studies, and Dr. James Muchera, Vanderbilt School of Nursing. So just kicking it off, Dr. Ziegler, can you just tell us about the health impacts of climate change?
Sure. So thank you for introducing us, and thank you all so much for attending. This is a topic that the three of us are really passionate about, and it really influences our work. So climate change is, it's happening actually much faster than we had originally predicted. So just this year, we're seeing temperatures, as you all know, if you're in Nashville, and really across the country and even across the globe, even into Europe, we're seeing temperatures we weren't expecting to see until about 2050. So we have increasing heat that then can cause sea level rise and more extreme weather. So the first sort of range of health impacts are those primary impacts just from those ecological impacts, right? So people can be, injured or lose their lives in extreme weather. And since we think about like the tornado in Nashville, right? Hurricanes, things like that. They can be impacted by sea level rise directly. But then in Nashville, what we see a lot of, in addition to extreme weather, are those heat impacts. So people can have direct impacts, loss of life, worsening of comorbid conditions just from the temperatures, right? So heat stroke, heat related death, those sorts of things. So that's how we sort of couch those first impacts as primary climate change health impacts. Then we have secondary, which are much more broad. And those are things like thinking about mental health impacts directly from stress, or if, increasing heat makes air quality worse. So as the air quality gets worse, children with asthma are impacted by that dramatically, both from outdoor and indoor air quality. People with COPD are impacted by that dramatically. Just the air quality itself can lead to cardiovascular disease. So that those can cause impacts. Anyone with allergies has probably noticed, especially in Middle Tennessee, that allergy season is much worse. If you're a clinician, I'm sure you're treating people for, poison ivy, rashes, things like that. And seasonal allergies much more frequently than I think we used to. So there's more allergens in the air. As trees get stressed, as the growing season gets longer because of the temperatures, they secrete more pollen. And so, so that also impacts people's health. Along those lines are vectors. So there was a paper that came out just last week that was where these researchers did this wonderful meta-analysis and really looked at how is climate change impacting infectious diseases. And they found that 50% of all infectious diseases were made worse by climate, either because the bacteria viruses themselves, they were able to replicate more quickly, the environment was more conducive to their success, and at the same time, stressed out the humans enough that they were more susceptible. So it's these very sort of complicated interactions. So vectors is another one. And in Nashville, Tennessee, the other way that we see vectors, or I know I spoke about this recently, the Tennessee Wildlife Resources Agency has seen alligators in Tennessee, which we didn't used to see before. And I know some of you have probably seen things like armadillos on the side of the road, which we didn't used to have in Tennessee. So armadillos carry the bacteria that carries that causes leprosy, right? So we just see, tick season is expanding because ticks now are getting killed off in the winter as much because we're not having as cold winters as we used to. And their range and their growing season, their breeding season is longer. So all these things are dramatically impacting folks. People that already have comorbid conditions, so people who are vulnerable, folks with asthma, heart disease, COPD, diabetes, and mental health issues as well, when they either have, because of heat or air quality, that can worsen those conditions, or the stress of an extreme event, which James is going to talk about as well, that can worsen those conditions. And then there's tertiary impacts, which are things like, when there's flooding, that can impact the water quality. So we can see increases in things like cholera, or water shortages. We're seeing now, frighteningly so across the globe and in the sort of grain belt in the United States, farmers are having these massive droughts. They're having to sell off their cattle. They're losing crops. So long term, we could see food shortages, increasing conflict, things like that. And along the conflict line, one thing I always like to point out that I think is really interesting is heat. There's a lot of research that shows that heat increases conflict. So if you just think about, if you're in your car and it's a hot day, your tempers flare more than if you've got AC on. So heat really contributes to conflict. It impacts mental health. And I think it's really important to state, and all three of us will speak to this as well, is that the people that have contributed the least to climate change. So we think about climate, right? It's caused by greenhouse gas emissions. We think about CO2, but it's other emissions as well, methane and things like that. And typically the families that have contributed the least to that, because they're typically low income, are bearing the brunt the most with their body. So thinking about families that live in public housing, they don't have air conditioning, right? Or they live in areas like in Nashville, I'm thinking of like James Casey apartments. That's in an I-40 corridor where their air quality is extremely poor relative to the rest of the city. So those families and those children that have really contributed the least to the problem, and this is true across the globe, the global South, right? And then within our own zip code, within, with my zip code just in Nashville, we see the same impact. So it's really an equity and a justice issue as well as a health issue.
Yeah, wonderful. Thank you, Dr. Ziegler. And listen, for those of you on the Zoom call, we encourage questions, type them in, and we're going to get to them at the end. So, and our panelists also can answer some as we go. Thank you so much. So, Dr. Muchera, so stress and health, talk to us about the impact of that and how it relates.
So, thank you for the opportunity and welcome everyone to this panel. I'll actually just elaborate on what Dr. Ziegler has talked about. So stress, is very common for sure. And many times you hear people say, oh, I'm really stressed today. And I don't even know how, a day would end without someone says, I'm stressed up. Well, it looks like it's a very common occurrence of life. But the stress we are talking about here is the stress that is perpetual, or stress that is, negative stress that causes some challenges in our bodies. So to begin with, stress virtually affects all the systems in the body. I'll talk about the respiratory system, talk about the cardiovascular system, talk about the endocrine. In many, many ways, you can link stress to all, a lot of physiology that is happening in the body. And for instance, stress is mainly, it causes some biological, mechanisms in the body to change. It's very much inflammatory, and actually that's the main reason why stress is, is linked to a lot of conditions. Talk about all the chronic conditions that heart disease, cancer, diabetes, even post PTSD and so forth. Stress is implicated in all those. And how it is implicated is, our bodies are fashioned in a way that they are able to manage some of the situations that we go through. And when these mechanisms in our bodies are not able to handle that anymore because of many reasons, and most of those reasons are actually these overexposure to stress, then the chemicals produced in the body, talk about the inflammation chemicals, and there are so many inflammatory chemicals, cytokines, and for specific conditions like cancer, disease, some of these chemicals are shared, like CRP. CRP is very common inflammatory chemical and is very much shared in most of the conditions. My area is cardiovascular disease, and I find a lot of elevation of CRP in people that have probably heart disease or hypertension, or even those who are not even have an overt cardiovascular disease. So it's a matter of these chemicals in the body, these inflammatory chemicals in the body. If you have a higher load of them, you might have CRP elevated. You might have another chemical like leptin elevated, and so forth. These chemicals, when they overwhelm the body, the cells are not able to manage that, and someone develops a chronic condition. And the problem with chronic condition is once someone develops one chronic condition, then it leads to another one, and and so forth. So the body's defense mechanisms are overwhelmed. And over time, people have started looking at, what is this total exposure of the stressful impacts over time. So you hear people talk about allostatic load, that's just stress, and how that stress is causing some issues in the body in terms of overwhelming the defense mechanism in the body. Stress will cause poor sleep. And recently sleep has been added as one of the eight risk factors of heart disease, that if you're not sleeping well, the chances of having heart disease or stroke are very high, and that has been supported by a lot of research out there. So and you realize that these conditions, like what I'm talking about, the cardiovascular conditions, cancer, and so forth, they have very similar shared risk factors. Once someone has a elevated blood pressure, then BMI and so forth, all these risk factors can lead to multiple chronic conditions. So in short, just not to talk about a lot, is that stress has been linked to a lot of health conditions, and most of these health conditions are usually chronic. And if you measure the amount of money, if it's financial impact, it will be huge in terms of how much money will be spent on and trying to address some of these health conditions when someone is admitted, or perpetual treatment and so forth. Thanks.
Absolutely. Thank you so much, Dr. Gutierrez. Dr. Ziegler introduced the concept of climate justice. Dr. Z, do you have anything to add to this and your thoughts on this?
Absolutely. I would really love to build on what Dr. Ziegler and Dr. Muchira were just saying. So climate justice and climate equity are a multidimensional concept and phenomenon, right? And we just talked about how climate change through extreme heat, extreme weather events contributes to negative health outcomes, including through increased stress, like on the body, psychological. And so one very important dimension, like really the central dimension to climate and environmental and other types of justice, is the distributive dimension, right? So it's really important to underscore that these negative health impacts of climate change are not equally distributed across different populations and across different demographic groups, right? And so if we look at the US, there's reams of research that's increasingly more conclusive that points to the fact that low-income communities of color and minority populations and communities bear the brunt of climate change impacts first and worst. For example, a recent-ish study that was absolutely just blew my mind was a study of 108 US cities. And so researchers looked at these 108 cities, like all the big cities you can think of, and they looked at summer heat temperatures, and they compared the temperature highs during summer heat episodes in historically redlined cities. So cities that were historically redlined neighborhoods in the city to their kind of middle class regular neighborhood peers. And redlined neighborhoods are neighborhoods that were predominantly minority neighborhoods that were intentionally denied access to home loans and other government and private sector services. Those are the neighborhoods that were later erased with the help of federal highway money, where thriving neighborhoods and communities of color were replaced with like public housing. And so when you look across these 108 cities, the historically redlined neighborhoods had summer heat extremes that were several degrees higher than other neighborhoods in the same city. And several degrees, like even Fahrenheit, could be the difference between life and death under this extreme heat stress. And initially this might seem surprising, but if you think about what historically redlined neighborhoods look like, it is not actually surprising, because there's a much higher percentage of impervious surfaces like asphalt that heat up, much lower percentage of tree canopy. And so increasingly there's kind of research that links the distributive dimensions of climate justice and the fact that the climate change impacts are being felt unequally among different populations. There's research that clearly links this to a history of institutionalized racism. And so that brings up the other dimension of climate justice and environmental justice, of course, which is kind of the procedural justice. So when we're thinking about climate adaptation, and a lot of cities are doing a great job of thinking about how to adapt to climate change. I mean, Miami was, in the news a year or two ago about appointing a chief heat officer and thinking about how to build resilience hubs, how to help citizens physically cope with extreme heat. But it's very important to think about the fact that we can't have a colorblind climate adaptation policies, and that you need communities that are most affected by this problem to have a seat at the table and a voice in decision-making, kind of participatory and procedural justice when decisions are being made about how to adapt to climate change. In fact, Carol and I and a few colleagues from engineering and folks from the Metro Nashville Sustainability Office were involved in a project that tries to implement this kind of procedural justice process in the planning of resilience hubs for Nashville and Davidson County, and to specifically consult communities who are most in need of climate adaptation, have the fewest resources to cope with and get relief from extreme heat, flooding, extreme weather events, get these communities into the planning process from the ground level, right? Because one of my main shticks is studying environmental policy and governance. And in the US, there's a well-established model of, community consultation where all the important decisions are already made and taken, and you just then inform the community and you kind of solicit some input or comments. But that's not really participatory justice. So it's both the distributive and kind of the procedural dimension of environmental and climate justice are very important. Like, who makes decisions about green energy? Where should it be sited? About climate adaptation? What are the needs? What are the projects? Those kinds of things.
Wonderful. So, Dr. Z, what are some of the things that we can do to decrease the greenhouse gas emissions?
So there's a lot of things. That's a great question. Oh, you mean for Dr. Z? I'm also Z. I'm sorry.
We're both Dr. Z. Go first, Carol.
Whichever one.
No, you go first, and then I'll go after you.
Okay, I'm going to start with the bad news that maybe you could bring us back up. It's a very good question, and also to me it is a very fraught question, because in my experience as a social scientist and as a policy person, when people ask that question, what they usually mean is, tell us some quick and easy steps we could take as individuals, like plant a tree, ride a bike, make a dent in climate change. And the bad news is that and even more often people are really asking, and it's like people in the upper income demographics are really basically asking the question of, how do we buy greener? And there is room for buying greener, buying local, but generally we can't consume our way out of the climate crisis or the environmental crisis writ large, because it's actually overconsumption in countries like the US that is a huge driver of the problem. And secondly, there's relatively little we can do acting purely as lone individuals to really make a dent in this issue. It's more about acting collectively, whether it's to agitate for policy or bike lanes in your city or sidewalks, that really makes the difference. And there's actually data to back this up. It's not just my hobby horse. Now, that being said, I'm not saying don't ride a bike, don't plant a tree. It's just that, even if you think about this in the Nashville context, most of the people who have the ability to ride a bike to work live in particular neighborhoods that are the more affluent middle-class neighborhoods that are part of this lovely new bike lane system. And so there's structural problems that prevent most of us from riding a bike, and we all need to work together to get the bike lanes to be safe and reach everywhere. Now, that being said, there are things we could do as individuals that pack more punch, right? So, lately, and I haven't done this myself, but I've been trying to sort this out. For those of us who are lucky enough to have started to save for retirement, getting your retirement savings out of fossil fuel heavy, mutual funds and index funds is actually a big one. And it helps in complex ways. It's not going to put the oil industry out of business tomorrow, but it really helps dethrone them a little bit and nudge them along. And so there's a few great resources. I'll put them in the chat later. There's this As You Sow organization that helps you really quickly look into the abbreviations of your retirement funds and try to get ones that perform equally well financially but are not heavy on fossil fuel holdings. So that's a big one. For those people who could still afford to eat red meat with this inflation, not eating red meat and buying local is, I suppose, also a great individual step. But those are some of the things that come to mind.
Wonderful.
I think just to add, I'm sorry, Kelly, just to add on to it, when you, just because some of you guys in the audience might not be in the climate space, so when we think about big, broad, overreaching things that we can do and need to do, what most folks say, like Mike Vandenberg and Jonathan Gilligan here at Vandy always say is decarbonize the grid, right, is number one. And number two is electrify the motor vehicle fleet. So it's like if you buy an electric car, but you plug it in and the grid you're plugging it into is dirty, it's not helping really a lot. And so like TVA, right? If TVA could go renewable, that would have a huge impact on climate change. Specific to the health sector, I think it's important for us as nurses and people that work in medical centers and things like that, to know that the health sector is a massive contributor to carbon emissions. I think if we were a country, would be like the 10th or the 5th, right? Largest emitter, just our sector. And if you think about our sort of charge, right, is to do no harm. We're doing quite a lot. And so there was a guy named Eckelman that put out a paper, I think last year, where he sort of quantified the top 3 ways the health sector, the changes that we can make to decrease our carbon footprint. Number one, I think, was changing the supply chain. So if we just were more intentional and conscious about what we're buying and how it's getting to us as a facility, that could have a massive impact. Number two was, I think, emissions from things like anesthesia gases and things like that. If we could change those refrigerants that we use, refrigerants are the number 1 emitter, which shocked me, but based on Project Drawdown, they were huge. Z will speak to that maybe. Yeah, they're a big emitter. So if hospitals can change the refrigerants they use, that's huge. And the third one was, I think, just the energy that's used in the hospital, right, to keep the lights on and things like that. So those are some things that we can do to have an impact. There's an organization called Healthcare Without Harm, which we can speak more about at the end, but they have basically a blueprint for things that we can do to sort of decrease our emissions as an industry.
Yeah, absolutely.
And if I can add just quickly here is, just in agreement with what my colleagues have said, the understanding that the consequences of climate change do not occur in a day. It's not very enticing to people that you tell them, hey, climate change is causing these things, but because they don't see those probably even diseases or people having floods and so forth, they do not see them like that very day, then it becomes very hard to, to propose policies or to enact policies. There is this competition that, there are priority things that has to be done right now. When things that are urgent hit, people always forget about the other important things like climate change. So it's about multisectoral approach, looking at how people can collaborate, health sector, financial sector, environmental sector, and so forth, so that at least we can all rally together to make sure that interventions that we are proposing could be supported by all. I know that that's not easy to be supported by all, but if it's supported by a good number of people, and with the understanding of the consequences that we don't act, what will happen, I think that will help. And even another example of specific of what we can do, look at the amount of the waste that is generated. Waste, and the waste of everything. An example is food waste and how much of the food is wasted and how that contributes to climate change. And like how much food, and I don't have the numbers, I had the numbers sometime, that it is massive. And if we just could calculate the amount of probably carbon, we and propose ways of how best to manage food waste, and even on an individual level, I think that would be some of the beginning points. Thanks.
Absolutely. So CHIL is planning to develop initiatives to promote co-benefits. And so, Dr. Z, can you help us understand what are the co-benefits and explain that to us?
Okay, so I'm going to take a long, but also just very simple and clear pathway to answering this question. So CHIL is the Climate Health and Energy Equity Lab at Vanderbilt that Dr. Ziegler and Dr. Muchira and I are just launching, or just launched just now this week. And so that lab started with the idea and with the observation that a number of otherwise well-intentioned policies, projects, interventions that are designed to help reduce emissions and mitigate climate change, those well-intentioned projects actually end up exacerbating health, environmental, and economic inequalities. And so that's kind of counterintuitive, right? Because to the extent that climate change affects marginalized populations first and worst, and that applies within the US and that applies globally, right? Like if you think about who's most affected by climate change now globally, populations like the urban poor in Bangladesh and India and Sri Lanka come to mind, and also rural smallholder farmers. So to the extent that climate change affects the most marginalized and disadvantaged populations first and worst, it seems logical that any kind of policy or project or program that helps mitigate climate change, it stands to reason that any kind of project that avoids emissions or reduces emissions of greenhouse gases would help improve equity, like health equity, economic equity, right? Because climate change is terrible for equity. So if you're solving climate change, you must be helping improve equity. That's actually not the case. So there's a number of cases where oftentimes well-intentioned climate mitigation projects and actions actually make inequities worse. So here's one example, and it might be relevant to the healthcare sector or really any large organization. You're having a conference, there's no way for people to come to your conference without flying. We haven't figured out a way how to electrify or decarbonize the airline industry. It's important to have conferences, so you decide to kind of buy offsets for your conference. So instead of trying to have a conference without any healthcare conference without any emissions, you say, okay, I'm going to be generating emissions over here, but I will pay for some kind of project to be done somewhere else that would avoid emissions or sequester some of the carbon that's already being emitted. And so one of the ways that this kind of climate mitigation is being done is through carbon forestry. And there's a bunch of companies in developed Western countries that essentially plant carbon plantation forestry. And so the way that this ends up, this kind of plantation forestry that is planted for carbon offsetting, and it's part of this voluntary market for carbon, the way that it ends up exacerbating economic and health and environmental inequity is that some of these carbon forests are planted on communal land where like subsistence farmers live off the land. And so those livelihoods are displaced, and once you're no longer able to use a particular area for your various activities, there's all kinds of negative outcomes, like both on the individual and the community level. So there's the co-benefits are like the positive side of that, right? Because you could have climate positive policies that have negative spillovers for social and economic and health equity. A great example from the US is cap and trade policies, right? Like those are great for reducing greenhouse gas emissions from the electricity sector and from power plants. You pick an area, you put a total cap on emissions, you let power plants trade with each other so that the power plants that could more easily reduce emissions reduce them. They sell permits to the dirtier power plants. From a climate perspective, it's an awesome way to reduce the overall amounts of greenhouse gases and like climate forcing. But from an environmental justice and health equity perspective, what ends up happening is that the dirtiest power plants that buy the permits and continue to pollute and emit not just greenhouse gases, but they also emit sulfur oxides, mercury, nitrous oxides, particulates. Those are often located in frontline communities, like poor communities, often communities of color. And so a perfectly good climate policy from a climate perspective could end up exacerbating already existing environmental and health inequalities. And so that really, so we have that, and then we have so much need for climate adaptation and resiliency in frontline communities that Carol was talking about in the beginning. So we took those two things and we thought, okay, you know, how can we design climate mitigation projects and policies if we specifically want those projects to not just reduce greenhouse gas emissions, but also to generate some kind of to also improve equity by generating tangible health or economic or environmental benefits for marginalized communities. And one great example of something that is being done along these lines, like one great example of co-benefits from climate policy in the US is essentially, instead of paying somebody to do plantation forestry in Uganda to offset your conference emissions, you could pay somebody to weatherize low-income homes. There was a program in East Tennessee. It wasn't done through the market and through carbon offsetting, but like there's been climate policies that either government or private sector funding. So a company pays somebody to reduce emissions on their behalf by weatherizing and improving the energy efficiency, reducing the emissions from home heating and cooling of low-income households. That type of thing has been shown to produce great benefits to health because people have more money left over to buy medications, eat healthier, have less stress, because sometimes if your home is energy inefficient and not weatherized, you can't even afford to properly heat it or cool it. And so these are the kinds of co-benefits, like how do you do climate mitigation projects that not only help address climate change and reduce emissions, but at the same time, as a co-equal goal, you want to help address climate and environmental and health inequities. And I'll just stop here.
I think one thing just to add to piggyback on James's point about sleep is, and Z, tell me if I'm wrong, but I think I remember, I did not read this paper, but I remember Dr. Gilligan, who I trust implicitly with his research interpretation, was sharing with me a study that they showed that weatherizing homes dramatically improves sleep quality, I guess because homes were less drafty. So just to tie it back into how that impacts stress and like what Dr. Muchira was saying earlier. Yeah.
Yeah, I don't remember that part of the study, but now that you're saying this, I remember just reading research from a California government public health official, and it was about like how heat stress produces negative outcomes in pregnancy and how people who are like repeatedly heat stressed. There's Dr. Rupa Basu. She's in some kind of like public health official role in California, or at least was a few years ago. And Bill McKibben was covering that in his blog, but there's a lot of connections, right?
Yeah, and if I could add, sleep is becoming a major factor. So the American Heart Association is the one that just updated their guidelines on sleep. So initially we have been having like a 7, they used to call them Life Simple 7. And now they are calling them Life Essential 8. Because they added sleep and other things, including smoking, which is smoking, vaping, e-cigarettes, and so forth. So there's a lot of debate about that. But I just wanted to add what Dr. Z talked about in terms of our efforts in Chill. We also aim to utilize data to look at what are the contribution of carbon offsetting on different metrics. One would be what is it that is happening in terms of health. So just to give an example, there is a study called the Global Burden of Disease, which measures the impact of several risk factors globally in a lot of countries, maybe like more than 135 countries, looking at the contribution of each risk factor in disease. Talk about smoking, environment, air quality, heat, stress, and so forth. So one study which they published in Lancet was they said in 2019, non-optimal temperature, that is very high temperatures and very low temperatures, contributed to 2 million deaths. Now, that is a lot. And then there is another metric they call disability adjusted life years. That is the time at which someone lives with a certain condition. For instance, if someone has diabetes at age 40, and they live with that disease with diabetes up to age probably 65, there is they call that a disability, the year lived with disease, all the years of disability, because these chronic diseases, they make someone not to their definition means you're not living to the full life. And at the same time, people end up probably the mortality, the life expectancy reduces. So disability adjusted life years measures that. So they said people lost in 2019 over those 105 countries over 37.2 million DALYs, or disability adjusted life years were lost. So using data, we could show what is the contribution of carbon offsetting probably on DALYs as averted, or what in terms of quality of life that was saved, or how many life years were saved. So it is this kind of data is important for policymakers to show them, hey, this is a long-term impact of implementing a certain intervention, for instance, for climate change.
Wonderful. Yeah, and I think, moving into a discussion of carbon offsets. So, Dr. V, and speaking of the concept of carbon offsets, and tell us how they work in related to Chill.
Yes. Well, so carbon offsets is another one of those very controversial concepts, right? Because it's a way of accounting, sometimes creative accounting, for greenhouse gas emissions, usually carbon dioxide, but not only. And so essentially offsets, to the extent that we need to dramatically reduce the overall amount of greenhouse gases that are being emitted globally, the idea is that since we don't actually, so for many things we have the technologies and the capacity, and it's economically feasible to completely eliminate emissions. So if you think about the electricity sector, we currently have the technology that's it's cost competitive to generate renewably generated electricity. But for other sectors like steel production, cement production, the airline industry, mining, we don't know how to continue doing these essential economic activities without actually generating considerable amounts of carbon dioxide. And so that's where the idea of carbon offsetting and kind of this carbon balance comes from. If you can't reduce as much by changing processes and models in certain industries, how can you avoid emissions elsewhere where it's easier to offset? And so, for example, nature-based solutions are a really popular way of offsetting emissions, because trees generally, although not always, sequester carbon. And so one way for offsetting carbon emissions, say from airline travel or mining or steel production that can't be reduced yet, one nature-based solution that's very promising on social and climate grounds is mangrove restoration, because mangroves were destroyed for agriculture and for other purposes, which leaves coastal communities in places like Southeast Asia very vulnerable. If you replant mangroves, they sequester carbon and essentially make up for continued carbon emissions elsewhere. Mangrove replanting also generates jobs. It generates coastal protection against extreme weather events that are exacerbated by climate change. But basically, offsetting is kind of a carbon accounting. If you think about the atmosphere as a bathtub, we're still pouring considerable amounts of greenhouse gases. So we need offset projects to siphon off comparable amounts, or else we get to like a 3-degree, 4-degree temperature increase world, which would become really unlivable for many populations and places in the world. So that's the idea of offsetting. And it's fraught because there's oftentimes these offsets, you know, it's cheap to buy certain kinds of offsets. So companies that have the technological and economic capacity to actually reduce emissions don't go for reducing emissions. They just buy cheap offsets because it's the easiest thing to do. But in order to claim offsetting, your money, like let's say you're a healthcare conference organizer, you're paying somebody to plant some trees or prevent some trees from being cut. And so this is what helps you be carbon neutral for your event. In order for all of that to work, you have to make sure that those trees would not have been planted but for your payment. And so there's a lot of carbon offset projects that sell these very cheap carbon credits on the voluntary market, but those projects, whether it's forestry or some renewable energy, they would have existed without anybody paying you know, the operators to offset carbon. And so that's where it gets problematic, because if you call everything an offset, then you're not reducing the net amount of emissions, you're just doing some creative accounting and feeling pretty good about yourself. Does that make sense? It's like a very technical area. I hope I didn't totally botch it.
No, that's wonderful. So talking about, you know, we want to get people involved, right? We want to get the health sector and the nurses involved. And so this is really for all of you. How can we contribute to the work, and how can we get more of our team members involved?
Well, I will start. I think one way there's an initiative called the Nurses Climate Challenge, which is led by the woman who is the education director for Healthcare Without Harm. She's a nurse, Shandana Morris. And so Vanderbilt participates in that. And that is an effort just to kind of get nurses educated about climate change impacts, and then also on advocacy. And I'm really happy to say that, so in nursing school, so we need to educate our clinicians, right? That this is an issue, both on the health impacts and on the advocacy work. So how do we promote mitigation? Because Dr. Muchira mentioned sort of the difficulty in getting people to connect this as an urgent matter, because unless they feel it, they don't feel it, right? And it seems sort of abstract. And then if we can connect it to health, though, it makes it much more personal. So nurses really have, I think, a really important role to play in that respect. So the Nurses Climate Challenge is one, embedding climate education into nursing programs. So VUSN has just done that with our new core 3 courses. The climate and planetary health is embedded into those courses. So we're really excited about that. If we could have, imagine, right? If insurance companies would pay for air conditioning. So I know someone put a question in the chat about air conditioning. If we had laws passed that really made it necessary, or you know, embedded in insurance payments and embedded into policy that people had healthy homes, whether by air quality, by, you know, weatherization. So kind of connecting those dots is something that I think nurses can be really powerful in. And then getting involved with like ANA, just trying to really get nursing organizations to sort of be at the front lines, yelling and screaming about it, because people listen to us because we're always the #1 trusted profession in the country. So the more we speak about it, the more we get people on board. I think also, you know, it shouldn't be political, but it does get political, unfortunately. And so nurses, I think, because we are in many spaces that a lot of people are not, we're in rural communities, we're in schools, we're in churches, we are on the front lines everywhere. We can really talk to people on all sides about just the health impacts. If you don't want to call it climate change, if you don't think it's caused by humans, that's fine. This is what's happening to people on the ground. You know, Waverly was flooded, whether you believe in climate change or not. Waverly was flooded, and that impacted people who grow our food, right? So I think we can really be uniters. Nurses can be the best uniters in some ways with this issue. And then finding these, like Dr. Z was talking about some of the co-benefits, James as well, finding ways in our practices to let people know, you know, even if it seems small, like vegetarian diets, right? The planetary health diet sort of aligns with the Mediterranean diet. So there's ways that we can promote these co-benefits in a way that benefits our patients and also sort of benefits the planet. Promoting green space, right? So when Dr. Z was talking about sort of the mitigation, so that we're in this closed system, and while we emit carbon, we need, you know, we're basically sucking it out of the deep ocean and putting it into the atmosphere. We got to either get it back into the ocean, get it back into trees, or find ways to get out of the atmosphere. And so forests are a great way to do that. There's a lot of research that shows that when people have access to forests and they spend time in forests, like their blood pressure comes down and they have all these sorts of health benefits. So finding ways to promote green space in especially low income communities, people could have access to gardens, things like that. I think those are all ways for, I think, for nurses to really have a huge impact.
Oh, that's great. I love that. So we have had a couple of questions and we've got time. We have about 10 more minutes. And so I'll let whomever answer this. One of the audience question says, predictions in increased temps in Nashville compared to Gallup, New Mexico. Ours increased a lot in 2030, New Mexico not at all. Why is that? Who wants to tackle that one?
We need a climatologist really to tackle that, but I'll take a stab, and Z and James, and we ought to jump in if I'm totally off. So some of it is you know, climatologists should speak to, because that's really out of my wheelhouse. But I know one of the reasons in Nashville specifically is sort of the urban heat island. So Nashville is being paved at a sort of an alarming rate, right? And the more we sort of have urban sprawl and we sort of decrease the tree cover and increase the concrete in our cities, the temperature will increase. And especially those nighttime temperatures, as they get above like 75, it's really hard for people, especially without AC, to kind of cool down. So it's really dangerous. But yeah, that's all I could say about that. Z or James, do you have a?
Yeah, I mean, when you get into climate prediction, I'm a little bit prepared to field a question like that, because I was just developing a syllabus for an interdisciplinary introduction to climate studies class. But the climate models, as sophisticated as they have gotten, are not super good at predicting on a very local level exactly, like with like great accuracy, what the impacts are. We know about larger trends, although I was just reading in this great you know, online media outlet, the Carbon Brief, that, you know, extreme weather prediction is now a subfield of climate science, and it's getting better and better. But yeah, the urban heat island effect and like other kind of variables that affect how the impacts of climate change are being experienced probably have a lot to do with what we're observing and whether or not we could predict it. Because you know, greenhouse gas levels in the atmosphere are not the only thing that varies, right? Like impervious surfaces vary, local environments, we vary those in other levels. So it's kind of tricky to predict. We're getting better at it, but that's all I have on that one.
Yeah, and I totally agree with Dr. Z and Ziegler. I don't want to add more, but just an example of what is happening in the prediction world. You of course, you're asking the question because, you know, we are not doing well in prediction of climate and weather patterns. Now, in healthcare, prediction models have also proven not to be working anymore. Modeling that was developed some years back is proving not to work for some reasons. And these are the things that we are talking about. There are things that have been changing over time, and these things have not been incorporated in these models. And people have started realizing, like, we need to assess other things that have not been assessed. For instance, we need to assess what about air quality? What is the contribution of these other non-clinical factors that we have not been assessing? So yes, if you read, you'll hear a lot of work is going on in this area of prediction, and risk scores probably in healthcare has been criticized a lot because sometimes they overestimate and most of the time they underestimate, and that leads to either not treatment or over treatment in some cases.
Excellent. I know that was a tough question. Thank y'all. Okay, I think one more, Dr. Ziegler, you touched on this some just a bit ago. Can you all discuss veganism's impact on climate and health?
Well, so I think two ways. One is, the way we treat our animals. So when we raise cattle, they release methane, and raising beef especially is just really carbon intensive, from just the animals themselves to the land they take up to transporting them, right? Just the way we do it, right? There's ways to do it where it's not as carbon intensive, but the way we do it in the States is extremely carbon intensive. So that's one way. So when you have a plant-based diet, just the footprint of your diet is much easier on the planet. If it's then also local, like if you grow your own food, obviously, like when you decrease the transportation of the food, you decrease the weight of the food. It's healthier also. So we know that if you're having a diet that's decreasing your risk for cardiovascular disease, cancer, diabetes, all the things that we know diet contributes to, which is most of the chronic diseases, you're less likely to access like an emergency room and be sort of a drain. And we know that tertiary care also is very carbon intensive. So primary care, keeping people healthy, has a much lower carbon footprint generally. And I think as far as also just the farming practices, typically if things are from like organic farms, there's sort of carbon intensive farming and less intensive farming. So those are some ways that I think vegan diets definitely can impact carbon.
And I really want to chime in here. So like the other Dr. Z, Carol, was taking this from like the bottom of up perspective, from like individual health towards the planetary level, like discussing veganism. And as a social scientist, I also look at it from the other perspective, which is reducing meat consumption and meat production especially would be a boon to individual health and the local and global environment in many ways, absolutely. But we can't do that by just changing our individual behaviors, because there's a huge agri-food complex and a very like highly concentrated meat packing industry. I mean, there's something like 4 companies control between 60 and 80% of meat production and packing in the US. And so those are some really important, politically powerful economic interests that have done a great job of preventing various kinds of sustainable food system transitions. Like I've done some work studying antibiotics use in meat production on food animals, and specifically subtherapeutic use of antibiotics to accelerate weight gain and get animals to market weight faster. And that is something that, as I'm sure everybody in our audience is probably acutely aware, this kind of subtherapeutic antibiotic use in agriculture is a huge public health problem because of antibiotic resistance and superbugs. And the FDA has been aware of this problem and trying to ban this kind of use of antibiotics since the 70s. And every time they try, the industry either sues them or drags them into congressional hearings and threatens to completely take away the agency budget, to the point where FDA has basically given up, and they respond to activists asking for antibiotics regulation. FDA is on the record saying, we would love to do that, but the last time we tried to restrict just one antibiotic in agriculture, the pharmaceutical and the agribusiness industries ganged up on us, and we did nothing else for 6 years. And so, again, it's really important to think about what could be done on the political level, and there are organizations that are actually targeting the big corporate food brands and demanding that McDonald's refuse to buy and sell meat produced with excessive use of antibiotics. Because that kind of strategy has actually worked in the past. Like when McDonald's decided they want to source humanely slaughtered beef, it changed the slaughter practices of the entire US meatpacking industry. And so it's important to also think about the structural levers and how do we nudge away the dominance of those industries that actually benefit from what is a very, unhealthy for the planet and unhealthy for people way of eating.
Excellent. I love that. And so we have about 5 minutes. And so I want to give some time to you all for last words. Thank you, Dr. Z, Dr. Nusher, and Dr. Ziegler. Anything else y'all want to add about CHILL and engagement from a community perspective? I know we've already talked about it, and I know you all said you were going to put some links inside the chat. Anything more?
James? What are you thinking about?
You go ahead. I was thinking about you talking.
Okay, I think the big thing, what we're trying to achieve with Chill really, with what I think is this dream team, not me, but these other two geniuses, is this idea that we want to find creative ways to really channel offset dollars or find a way to really get investment in low income communities in Nashville specifically, right? To benefit their health in a way that also benefits carbon. So it can be almost like a model for other industries and across the country. So that's really the idea behind Chill. Also excited because it's part of the immersion program. So we'll have undergraduate students from across the university sort of right there with us. And we don't, it's going to unfold organically. We don't know what they're going to come up with. We don't know what we might come up with. So it's really exciting, I think, just to be working on this. I just think in leaving, I want anyone on the call who is in nursing just to really feel like this is part of our, it's in our wheelhouse. It's part of our turf, right? So dealing with climate and human health is absolutely, work that we need to be doing. And so just feel ownership of that and feel like you can go out and get involved.
And one thing I suspect you guys are going to second me on this. One thing that we didn't mention is that we're going to look into it as a research question, the extent to which improved health outcomes for chronically ill patients, like in the US context specifically, the extent to which improved health outcomes for chronically ill patients are also associated with reduced emissions from healthcare, because there's some initial data that suggests that like intensive care, critical care, are some of the most energy intensive parts of the health system. And unfortunately, like poverty and lack of resources and marginalization correlates with higher levels of chronic disease, more use of the emergency parts of the system. So we're hoping to capture some of the spending on climate mitigation, channel it towards improving health incomes in low-income marginalized communities, and then possibly we're going to look into whether that creates like kind of a positive spiral and like further benefits for climate as well. So we're really excited about that part.
Yeah, just gonna say thank you so much for the opportunity, and we will welcome ideas. This Chill will be an incubation center for ideas as well. So in case you have anything, you visit our website, and if you have something to let us know, please, we'll be welcome. We'll be appreciating that. Thank you.
Absolutely. Thank y'all so much. This has been absolutely engaging, very informative, and I see the links being posted on the site. I know it'll be recorded and people can watch it, and I'm sure feel free to reach out to any one of us if you have any additional questions. Thank y'all so much.
Thank you.
Bye.
Bye.